The news cycle can feel pretty brutal these days. We know between the ongoing COVID-19 pandemic, the monkeypox outbreaks, the more than 300 mass shootings in the US this year, the heat records shattering, it's really easy to feel like the world can be an overwhelming place. Just in the first 9 months of the pandemic, researchers at Boston College found that reports of mental health struggles shot up. Among US adults aged 18 to 29, reports of anxiety and depression increased to 65 and 61% respectively. Use of prescription medication, counseling, and assorted mental health services also rose significantly. And there's one group that faces a special set of challenges finding healthcare that often gets overlooked. We rely on a lot of people on the front lines of a crisis, especially in the medical field, from emergency responders to grief counselors. And we want to take a moment to ask ourselves, who's there to help the helpers? A recent study from the Physicians Foundation found only 14% of doctors seek mental health treatment. Often that can be due to trauma, but also burnout from the pandemic and long working hours. Even in the medical field, stigma often keeps people from getting the help they need. Many physicians actually face barriers and discouragement from getting or even asking for help. Doctors may be restricted in how they practice medicine or even lose their license after psychiatric review, sometimes for something as straightforward as asking for more lenient hours. As a result, oftentimes, doctors don't feel they have the power to ask for help. Studies indicate those in the medical field experience suicidal ideation at higher rates than other professions. So, how do we help the very people we depend on for our own crises? Newsy correspondent Amber Strong explored the unique challenges they face and some of the calls for solutions.
Carl Stokes lives here on the east side of Buffalo.
There's been a lot of talking people down and trying to bring people up.
After a mass shooting took the lives of 10 people just down the street at the Tops supermarket, the crisis counselor began treating people from his own neighborhood.
I've come home quite a few times and was a little bit shaken by some of the stories.
Buffalo nurse TRINETTA ALSTON and Dr. KENYANI Davis say it's the stories from the Tops employees, their patients, that haunt them.
You get tired of hearing about things happening in your community to, people of color. You get tired of it and you try to find the why.
You start to see how broken the system is, and the most you can do is take a step back. But every day you take a step back, there's other people that's suffering as well. I don't know where the helpers go.
Community leader LAVONNE ANSARI held conversations with police officers and funeral directors, all struggling after the event.
What would make you think that they don't have feelings, that they're invisible?
It was Fred Rogers who famously said, "Look for the helpers." But where do the helpers go for help? Between the pandemic and gun violence, the last few years have brought an onslaught of mental health challenges to first responders. A 2021 report from the Physicians Foundation found 55% of physicians say they know a fellow doctor who has considered, tried, or had a death by suicide.
That historical separation of the work stress and home stress has become artificial now, and you're seeing lots of folks experiencing both.
According to a survey from Trusted Health, 60% of nurses say they would be afraid to share feelings of depression or suicidal thoughts with a colleague. The main reason? Concerns about confidentiality. Dr. Bernard CHANG is both an ER doctor and a psychologist and heads up Columbia University's research on physician burnout. He says stigma keeps fellow physicians from seeking help.
Documentation burden, fear of loss of control over your schedule as being some of the primary drivers of clinician burnout or people leaving the field. And I think that as system administrators, we really need to be aware about that and take those voices into account as we think about strategizing about the most efficient healthcare design.
The study calls on employers to create an environment open to talking about mental health.
We have this cultural mindset of being above the fray and also being just immune to some of the stressors that we see. And I would say it's okay to be vulnerable. It's okay to seek help.
Back in Buffalo, Alston says she has taken advantage of some of her company's mental health exercises and finds them helpful. She also finds strength in remembering her purpose and that she's only human.
This is what I asked for. I didn't ask to be rich. I didn't ask to make $40 an hour. I didn't ask for none of that. I asked God to let me show love that was shown to me. And where but in your community can you do that?
Amber Strong, Newsy in Buffalo, New York.